After Walt's talk, you know that you're not going to want to put anything in your mouth, so mine may not be necessary at this point. So anyway, no. Your mouth, the beginning of health or not. And I'm going to go through about 9 or 10 topics here. I could take an hour on any of these topics, so this is going to be a whirlwind. I'll leave some time at the end, and if somebody has a particular interest, I can go into more detail on any of those. But that's sort of the way we're going to wrap it up. I have some handouts that have some of the important things and some references where you can find information. But that's sort of how we're going to do it. I always bring my family with me any place I go. So I've got 10 grandchildren now at this point, all under the age of 6.5. So that's my experimental place where we go. All right, so one of the things I want people to start to think about is we've always thought about teeth as pegs in boards. Well, teeth are not pegs in boards. Teeth are organs, and they're actually a very complex organ hooked to our brain, hooked to our blood supply, and they have their own system within it. So when we think of the tooth as an organ, that changes the whole dynamic of the way we want to talk about this. And somewhere down here, we're going to talk about the paradigm of tooth decay, and that has changed since I went to school years ago. Oral health relationships. Okay, what is it that we're talking about? One of the first things we like to talk about is nutrition, as Walt said, because some of those products he put up there have a direct effect on what they do to your saliva. They also have direct effects on neural feedback to your brain stem. Your hypothalamus and your parotid gland, which makes your saliva, are very intimately connected, and the foods that you're put in your body have a direct effect on that. One of the main ones is sugar. As I tell my patients every day, if sugar was discovered today, it would be classified as a drug because it goes straight to your hypothalamus, shuts off the parotid thyroid hormone, and your parotid gland immediately stops functioning the way it was intended, which means the fluid flow, which means we have blood and fluids flowing into this tooth to keep it healthy, reverses. So it would be nothing different than the blood flow reversing in your heart. It wouldn't work very well. It's no different than when the fluid flow would reverse in your lungs. It doesn't work any well. The same thing, when you eat sugar, it reverses the fluid flow in your tooth, and it no longer works well, and it gets sick, just like your lungs would get sick and just like your heart would get sick. So we'll look at that as this. So that's one of the first things. So I throw sugar out there, and I throw white flour right behind it because flour is nothing more than a bunch of sugar molecules hooked together so that they can be broken down, and it's like eating a big explosion. Having dynamite rather than a firecracker is really the only difference between sugar and flour. So we throw that out as some of the first things. Okay, tooth decay, cavities. We're going to talk a little bit more about those. Mercury fillings. So it makes sense to put a poison on top of an infection. Those of us that are old enough remember mercurochrome and merthiolate, that red and the orange. The mercurochrome was what your mom put on if she was going to be nice. If she wasn't happy with you, she put on merthiolate because it burned. Mercurochrome was 0.5% mercury, and merthiolate was 2% mercury. Well, the FDA said, we can't put mercury on your skin because that's way too toxic, but we're okay to put 50% mercury in fillings and put them in our mouths and store them there for our lifetime. So you figure that out. Not all wisdom is wise. So anyway, that's mercury fillings, other toxic materials. Any other part of the body where we go to put something permanently, it has to go through stringent approval processes. Well, there are so many chemicals that make up filling materials now that there's a company that has a full-time job of testing those and doing antibody titers on those because of the same things that he was talking about, all the different products that are out there. So there are dozens of things that are toxic that just get put in your mouth without any thought or anything to that. Periodontal infections, You know, what we're talking about there is the infection of the gum tissues around there. More people lose their tooth to periodontal disease than they do to cavities, actually. Periodontal infections, a significant amount of them are parasites. We do microscopic studies on our patients when they come in for their hygiene visits and their regular visits. In the fall, we run probably 60 to 70% of the patients have parasites when we do a microscope exam. And so it is real motivating when you throw it up on the slide and these little critters run across the screen and you say, well, we just took that out of your mouth and maybe we should think about doing something about that. And so one of the reasons is if we have a low-grade infection in our gums and we've got parasites in there, brushing and flossing does not kill parasites. You're not going to beat them with the toothbrush, and you're not going to hang them with the floss. You have to go, it's a systemic problem. So it's the same thing. You don't cure periodontal disease by getting your teeth cleaned 2, 3, 4, 6, 8 times a year. That just isn't really what it does. If you don't go systemically, you're in trouble. Yeah?
The parasite that you found in people, are you doing that from a saliva sample?
Yes.
Yeah. Okay.
Yes.
Wow.
Wow. Yeah, that's what the patients say. Wow, that was in me. And we've seen all kinds of creatures. We've had some people, we had somebody come back from Nicaragua, and he had it, I swear, it looked like a million-legger, if you guys that have been on farms, you know, and it was running across the screen, and it had more legs than you could see. And we've seen some pretty wild things. Most of them are just little typical round things with, you know, flingy arms, and they just skirt around and fly around. But every once in a while, you'll get something real cool. Or you'll get an amoeba, okay? You know, amoebas growing in human beings are not like supposed to be. That's a very unique thing, but we will see those occasionally too. And those people have more than gum disease. They're not well, and they don't know they're not well. They're just taking a whole lot of medications for all these problems that they think they have. Okay, and you know, it can be those parasites are not just affecting your gums. They're affecting everything in your body.
So
yes?
You're seeing amoeba in people that haven't traveled, like that doesn't have to do with travel, right?
No, well, no, they can be anywhere. Yeah, I can say. Yeah, every time I go over, every time I go to Costa Rica, I go on a mission trip, and we go, and you know, we eat what we eat because that's what we have, you know, and drink what we have to drink, and I've come back with some funny creatures myself, but you know, I just do a parasite cleanse every time I come home, and that's part of my life, you know. I also raise horses and dogs, and I treat them too, and I'm on the same routine because we all live together, and anything else is sort of delusional. Okay, and then the fifth aspect is, you know, bite force trauma. What we never think about is the fact that the nerve tissues running through your tooth are actually part of your brain stem. They're part of what they call the cranial nerve system. So literally, the nerves inside your teeth are part of your brain. And if you are traumatizing your teeth, you're bruising these ligaments, you're bruising those things, there's a direct feedback mechanism to the brain that will prevent you from doing that no matter what, because your brain is smart enough not to give itself a concussion. So what you do is you develop abnormal swallowing habits, abnormal jaw positions, and this can start at age 2. Okay, so you know, we look at things and create those. So now we have an abnormal swallowing habit. Now we have a sleep apnea or a breathing disorder that's developing in a child. So now when you're supposed to be sleeping at night and having the oxygen come in and restore and rejuvenate your body, well, now it's in crisis because you're in oxygen deprivation when you should be healing. Okay, so you know, a traumatic you know, so people who are clenching, grinding their teeth, gritting their teeth, all of those things, you don't do that if you're breathing properly. That is just a way, if you clench and grind your teeth, what you get to do is you get to open your airway. So it is a reflective mechanism. Your brain is telling itself, I need air. Here, if we do this, I can make more air come in. And you do it subconsciously, because how many of us pay attention to our breathing? Okay, very rarely. Your brain is smart enough to breathe and try to fight and get oxygen at the expense of your teeth. So, now we create head and neck traumas. We have patients come in with pain all the time. Anything from C3 up. If you have pain in your neck from there up to the temple, to the occipitals, it's probably 85% of the time it will have, 85% of the time it's almost all bite related due to some kind of trauma. And you only have to traumatize one tooth to create this kind of an imbalance in your whole head. So, the person has to go to the chiropractor twice a week to make their body stay lined up. It's always a bite problem. It is always a bite problem. I've dealt with thousands of patients, and it's always a bite problem. So I have dozens of chiropractors all over the 5-state surrounding area who refer people to me just because at some point they know. And then I have other chiropractors that I've worked with that after I fix their patients says, well, I'm not sending you more patients because they don't need to see me anymore. And unfortunately, I've had that type of response. I've sent a few back, and it's like, yeah, they don't need adjustment, And I was one of them. I lived there, It was like, my job is not kind to your back, leaning over, working on people all the time. And so, I did. But with recent stuff that we've learned in the last 10 years, I've fixed myself, and I haven't been to a chiropractor in 10 years. And with some other therapies that my chiropractors that were interested in me not seeing them regularly taught me, between those two things, I don't have issues anymore. And my back is stronger now than when I was 40. I can work harder and do things that I couldn't do 20 years ago. Okay, so that's bite fork trauma. Nobody thinks about that being a systemic problem, but it does. Because when you've created that, you also are usually blowing out your adrenals, because if you're in oxygen deprivation, the way your body responds to that is, think about the fight or flight kind of thing. When your body's tired and it's worn out, the response is, okay, I'm not getting enough oxygen, I'm tired. Well, we'll kick in the adrenal glands, give a little adrenaline, and we can make that work. Well, so you do that, so you wear your adrenals out in your sleep when they should be recuperating. And Walt probably understands the adrenal cortisol thing imbalance more than I do. But, if you have bite trauma, your adrenals will never be healthy. That I can tell you. It just doesn't happen. Okay. Now these other 4 things here are instances where the teeth themselves or the problems of teeth are now causing systemic problems. So the first ones were sort of the other way, but these ones we have a direct effect. We know that this causes problems. Dead teeth or root canals can be infected with anything, and all of those will create issues, and we're going to talk about that a little bit more in detail. Something that we're not talking about, I hope I didn't put the slide on that one because they're not there. Cavitations, we'll show you a picture of that. Basically, think of a cavitation as you think you get your tooth extracted, so now you've fixed your problem. However, if that little ligament that was on that tooth before, around here, if you leave a few of those fibers in there, and there's a few bacteria that stay in there, and the bone heals up around that nice and neat, but you've got those fibers, these fibers in utero to having the problem in there. Okay, but an exciting thing that this gentleman discovered, and I just went to his lecture here this spring, we always thought that once you were an adult, bone growth was no longer possible in the maxilla. But he figured out that if the person was willing to go on a very strict but real food diet, you actually could turn on enough stem cells in the bone fragments of your jaw, and with appliances that we all use as orthodontics, and just applying them physiologically in a different order, he actually has 60-year-old patients that he has grown their maxillas by 20 and 40%, which a year ago, if somebody would have told me that, I said, that's never going to happen. That's against everything we know about the law of the way bones grow. Well, we don't know everything about the way bones grow. And But the caveat is he doesn't even start treating one of these patients unless they're willing to do the diet first, because he says it never works if they don't do the diet. So it's one of those things that really you as the patient are really still always in control of where you end up. But that is an amazing thing, because now people that are willing to do, and it's a process. I mean, it's a 10 to 15 month program to get this growth to occur. So it's not like going to be an overnight thing, but still, you know, instead of living with a mask for the next 20 years, you know, is it worth it? You know, and there's usually some other underlying bite challenge that's involved in there. So the exciting part of that for me is because I do a lot of orthodontics and child ortho, young ortho. My goal is always not to have to put braces on kids, because we like to grow their teeth in the right position first. And so, you know, we do spend time talking to parents about nutrition, which I need a wall around sometimes to help. But because that is the first step. But, you know, even so, what we have found now is, and we've always known that we could start to predict, you know, I'd see the kids at 2, because we try to bring kids at 18 months old so I can start to evaluate diets and get the kids growing the right way. And by 2.5, I could tell you which ones we were going to be having to straighten their teeth, because it was 100% predictable, you know, because the growth patterns were already there and they've already started to be in imbalance. Like you said, in utero, they happened. It's already been going on for 3 years at 2.5, and you knew who they were, and we just marked in the chart, you know, evaluate, you know, and we would be able to start talking at about 8 of some appliances that we could put in to try to avoid braces and do the growth thing. Well, there have been some other research done, and now we're actually able to start these kids at 2, between 2 and 4. Okay, and you think it's crazy to get a 4-year-old to wear an appliance, but they are much more fun and easier to work with than an 8-year-old, because that you can put the appliances in, and because they're growing so fast, instead of needing 4 to 6 hours of work, they only need 3 or 4 15-minute intervals a day. So what happens is I make the parents spend time with their kids, which is never a bad thing for the kids. So now the kids have really an hour of playtime with mom or dad by their 15-minute exercise time. And at the end of a couple months, the kid wants to do it more than the parent wants to do it at that point, because we've actually filled 2 voids that we have in our society with parents and kids, little kids not spending enough time together. And because the rapid growth at that age, you can actually fix it in months rather than years. And then once you get it started to be fixed, we can just finish up with appliance and guide the teeth right into place and pretty much eliminate the need for orthodontics at all in 12 and 15-year-olds, which is, I mean, when I did ortho, that's what we did. We just said, okay, just wait till they're really crooked and ugly at 12, bring them in, and we'll fix them. Because, you know, some of the other older functional appliances we had, you know, you were wearing the kid out for 6, 7, 8 years trying to get them to wear different things that didn't feel good. There were these contraptions with screws and wires, and, you know, and I've used them, and you try to talk kids into believing that this is for their own benefit and it's going to be good for them. And, you know, that argument goes really well on a 10-year-old. But, you know, so these are what's really neat, because what they're finding is that 40% of these ADHD, ADD kids, they're really sleep apnea kids. They just have been living without oxygen. Just to run through some of these in more detail. Nutrition, the optimal range of saliva pH needs to be about 6.8 to 7.2. And that depends on when you've eaten, what you're doing, and if your saliva glands are working properly. Anything outside this range makes bacteria able to grow. Acid-producing foods to avoid are your sugar, your grains, milk. You know, the dairy farmers hate me, but milk should not be consumed by most of the population. We don't have the enzymes to digest it properly, and if you're not getting it directly from the cow, you definitely shouldn't be eating it, because it's not really milk after what they do to it and they break it down. All it is they create proteins that go through your gut and destroy the whole gut system, so that you'll get to have other problems. And, people always want to drink their healthy sodas because they're sugar-free, but they don't realize the phosphates are just as damaging, if not more, than the sugar that's in there anyway. And then we have metabolic variations in producing energy for foods, and that's just every human being does not have the same enzymes being most active in your system to produce foods. And and there were several old nutritionists that proved that fact, that you could even switch by causing strains that you would eat. You would need more proteins, more carbohydrates, more fats, and the enzyme systems can actually be influenced by physical activity, by what you eat, by illness. So those all need to be taken into account. Tooth decay. Like I said, tooth decay is actually a systemic disease first, and it's because of the reversal of the fluid flow through this tooth. We got all these little micropores in our tooth. These are little bacteria here. So what happens is, whenever the fluid is flowing properly, you're you're constantly washing the bacteria out of the holes. As soon as you do this, now you've just created a sweeper, and you suck the bacteria right into the pores of those teeth. Because we have this image that a tooth is a nail. Well, a tooth is not a nail. It's an organ with all these little microscopic holes in it that are plenty big for a bacteria. And the whole family can go through that tunnel at one time if they want to. So, that's what we're looking at there. So even in a metabolically unbalanced person, even normal healthy bacteria, which we need, because without bacteria we don't digest our food properly. And that's probiotics is a whole nother 3-hour lecture. Realistically, yeah, and that would be with only what I know, which is not much, because it changes literally by the month as far as what they're discovering there. But any of your simple carbohydrate foods, processed foods, are not what the human body was meant to eat. It was not what we were meant to eat. Okay, and that was the old paradigm of, I have this paradigm on your sheet. Let me say, yep. All right, steps in the systemic paradigm of dental caries. When I went to school, this is what they told us how tooth decay happened. Down there at the bottom, we had plaque and cariogenic oral bacteria adhere to the tooth. You feed it more sugar, and the bacteria produce acid. They demineralize the tooth, and it goes in and makes a cavity. And I forgot to ask my hygienist if that was still what they were taught, because she just graduated 2 years ago, if that's still what they're teaching them, because I think that's what they are still teaching. But in truth, what we know is a cavity is a systemic process. So one of the values of your teeth are, if you're not getting cavities, you can make some assumptions about your health. And if you're not getting periodontal disease, you can make assumptions about your health. And if your gums will not allow parasites to grow, you can make some assumptions about your health. So actually, a dentist who understands how to read all of those things will find out things long before you go get a blood test and your doctor tells you you're sick, and you know that you haven't felt well for the last 2 years. I mean, because it's going to show up in your mouth as places that bleed. There should never be, okay, if we had blood coming out our nose or from under our fingernails, would we be concerned? But when we floss and we get a little blood on the floss, oh, that's okay. Why? Why is that okay? When you wash your hands, do your fingers bleed? When you do other bodily functions and blood comes out, would you be concerned? Are you concerned? Well, why should it be any difference in our mouth? And it shouldn't be. In a healthy mouth, it should not be. So anyway, this is what we know now is the way tooth decay really occurs. Because you can have, and I have it, and I've seen it, and it was always fascinated me. I had people who came in who had never brushed their teeth in years. I mean, years, because it took a power washer to find their teeth. But when we did, they didn't have any cavities, okay? And they didn't even have gum disease, some of them, okay? But in fact, that's because they had these other things going on systemically that allowed for the junk to live there without causing damage. Okay, you know, and number one on the list is the ingestion of fermentable carbohydrates, especially simple sugars, okay? And what they do is you eat those foods, you get an instant increase of blood sugar because they get absorbed right in. It's not like when you eat whole foods and you get a little bit of sugar slowly ingested. And what that does is, ROS stands for reactive oxygen species, which is just a fancy name for free radicals. If you're a biochemist like I am, we don't speak normal language, okay? But so that's free radicals. So as soon as you get these free radicals floating around, your hypothalamus picks that up and it says, whoa, that's not good. We shouldn't be having these things in our body because free radicals don't just happen in one place. It's a chain reaction. It's sort of like an explosion that happens throughout your body. The hypothalamus gets that, and what it does is it automatically does a downregulation of the parotid stimulating hormone, which is in the hypothalamus, because that's just one of the things. It's like, this is not the most important thing. We need to take care of these reactive oxygen species that are happening here. And it immediately changes the way the parotid hormone excretes. And one of the purposes of parotid hormone is not just to excrete saliva, but it's to cause the blood flow from the tooth into the mouth. Okay, and so that actually halts that flow and it stops it. It's a chemical reaction. It has nothing to do. It's a feedback mechanism to your teeth, and it will just happen every time you eat sugar. And if you ever think about it, if you get your teeth real clean, you got that nice smooth feeling, and you go eat some sugar, and you haven't brushed them then for an hour or so, all of a sudden they have that fuzzy feel. Well, they have the fuzzy feel because the fluid flow reversed for an hour, and it just sucked all kind of stuff to it. All the little proteins and glycoproteins and mucinogens that were in your saliva just stuck to your tooth because it was a sweeper. It was a sweeper sucking all that stuff in. Each one of those teeth are little organs, or little vacuum cleaners, and they're either blowing things out, keeping it clean, or they're sucking in the trash. And that's the choice. And it has nothing to do with how much, it has to do with what's going on in your brain. So realistically, sugar isn't the only thing that does that. If we see patients that have chronic inflammation, you live with headaches, you live with neck pain, you're creating free radicals because that's part of the pain process. You get the cortisol and pain and all those imbalances, the adrenal things, and you know, anything that causes free radicals to be exacerbated in your body is not good for your teeth. So it's not just sugar, it's a whole big systemic issue. Okay, and then yes, you do have to have bacteria. If you sterilize, the only place you can find a sterile mouth is in a dead person, because anybody that's alive will have bacteria. So the bacteria are smart enough to leave a dead person because they don't have anything that they need to feed on for those type of bacteria. Now, you have other ones that come in and do other things, but the ones that would normally live in your mouth, they immediately are gone, you know, within hours of being dead, or they transpose into another type of bacteria because some of them are able to do that. So anyway, so that's what we have. And sure, the sugar does feed it, but it's just not feeding the bacteria there, but it's feeding the whole system, and it's creating that in there. And then dentin inflammation is that when you eat that Tootsie Roll and it's like, did that tooth hurt? Did that feel funny? Okay, you know, that's what we call dentin inflammation, and that's just that area in the tooth. We got another tooth here somewhere. Oh, there we go. That's just this area in the tooth right here. This is called the dentin, and it's full of little microtubules. It's just like thousands of straws lined up with hydraulic fluid in it, and whenever you change the acidity in your mouth, you change the hydraulic pressure within those tubules, and the nerves inside your teeth are just like your brain, okay? You know, you've heard of people having brain operations. You know, they cut it open, you can touch the brain. It doesn't hurt, okay, because the brain doesn't have certain receptors. Well, the teeth are the same way. The teeth don't have salt receptors. They don't have sweet receptors. They have pain and pressure receptors are the only types of nerve functions that they have. So that's why when you have a tooth problem, Even if it's sugar going in a hole, all you feel is pain because that's the receptor that you have to interpret it. So that's where we are there. So if you understand this, you will understand more about tooth decay than 9 out of 10 dentists that you would walk into their office because they're still thinking that you just need to brush harder or longer or floss more and eat less sugar, which is a good idea, but you can do all of that and you can still get cavities. And all that means is you have another issue in your body. So your teeth can be a great warning symbol for you for that to happen. Now, the challenge that most people have is because of our insurance system that we've set up, you have a limited amount of resources in your mind because the insurance company only pays so much a year. So what dentists have done is, in order to placate their patients' wallets, they say, well, we'll just fix this cavity this year and this one, and we'll just keep working at it slowly. But what you do is you leave behind the system that's causing the problem. So in order to fix this system, you need to go in and in as immediate amount of time as possible, eliminate all of the decay-producing bacteria that you can and replace them with healthy bacteria. And then start working on the systemic process. And then if you still get new decay, you know that it's a systemic issue that you can work on. And that's what Ella and Walt are for at that point. We say, you need to go here because you're still getting tooth decay and we've taken care of all of these other issues. But as long as you leave a couple little cavities around behind, you never know where it's coming from. Is it truly still systemic, or is it just I didn't do a good job in hygiene and my system is weak, and and they've taken advantage of it. Okay. Where are we on my time? So I got 10 minutes. All right. Mercury fillings. I'm not going to talk about that. I talked about that already. It never made sense to put mercury fillings in your mouth, and that's just part of what that is there. The reason for that is, there's all kind of. We all have different abilities to excrete mercury fillings. So some people can tolerate them better than others. And I will just say that. And, but if you're going to get mercury fillings out, you want to do it safely because you don't want to have an exposure. So you need to have drapes. You need to have nutritional support ahead of time because you will be exposed to some during the process. You want to use compatible dental materials. So we actually do blood studies. We can have blood draws. We send it away to a company, and they test your antibody titer against all of the other filling types of materials out there because all of them are some type of chemically created substance. Okay. Hopefully they've got mostly silicone but they got to have some kind of glue that holds it together. And so that's chemistry. And because we are exposed to so many chemicals out there, a lot of people already are allergic to dental materials that they've never had in their body just because of comparable plastics that are available. They must be taken out in a proper electrical order because there's electrical currents in metal fillings, and those electrical currents are anywhere from 10 to 1,000 times the electrical currents in our nervous system, and they're only sitting about 1.5 to 2 inches away from our brain stem. And so it is doing something to your brain if you have metal fillings in your mouth. We provide oxygen, suction, charcoal rinses. So those are all available on some of the other sites that we have for references. Periodontal infection. I say, yes, you have to learn to have immaculate oral hygiene, and you have to go to a dentist or a hygienist that's willing to say, hey, here's where you're missing. Here's how you take care of it. Here's how you take care of that part of it. But healthy gums do not bleed. They just do not bleed, just like anything else. They have sonic toothbrushes, floss, oral irrigators, rinses, picks. There's dozens of things. If you're not familiar with oil pulling, we recommend that for a significant amount of our patients. The short story is, you take some coconut oil, you mix it with some clove, oregano, CoQ10, you swish it in between your teeth for 15 to 20 minutes. and it does different things. The oils soak into your gum tissues, which then the parasites and the bugs don't like living there after that. It flushes things out. Coconut oil has other healing properties and antimicrobial properties, and the CoQ10 allows for fibrous tissues and collagen type tissues to heal better if you've got it locally active in the healing process, so it just allows for healing. And then professional cleanings per year. We have patients that come in anywhere from two months to once a year, okay? And we base it upon what they're doing, how they're living, what their nutritional habits are, and how well they're taking care of themselves. But, you know, twice a year doesn't fit everybody. You know, that's not where you win. And, you know, if you're not having microscopic evaluations, you really don't know what's in your mouth. You really don't know what's in your mouth. And it can be a lot of fun to know that. Okay. Yes?
What is the parasite cleanse that you do after you've gone overseas?
Oh, I have actually we stock about 3 types of parasite cleanses, and it sort of depends on the type of patient that I have come in, because to sell a $500 9-week parasite protocol to somebody who's trying to decide if taking a multivitamin is a good idea is never going to work. So for those people, we start them off with a twice a day paracleanse kind of supplement. So there's different ones out there, and the truth is all of them work to some extent, and what we do is we test, you know. And so if we have somebody, because you could spend $90 or you could spend $500, or you could go on a 21-day total body cleanse and spend $1,200 or more. So it sort of depends on the level of knowledge that the patient comes to us with, and we decide what's best. I've actually been impressed with some of the less expensive, one supplement parasite cleanses that we've had. And then sometimes well, that was fun, but now we have to do something different. And so like I said, it all depends. We use that as an education process, and because we have the microscope, we know when we're done. Okay, when I do it, I just shoot the big ones, because I'm living in the barn, I'm going to Costa Rica and eating jungle food, and I just want to be sure. And the big the full cleanses that you do over 9-week periods with different intervals, you're cleaning up when you do those. So yeah, standard process has a good one. We use that one. I use the biotics one every once in a while, and we have some people trying that right now, so we're going to see how that works. We have some people want to, yeah, and I let patients, if they think they want to try their own, I'm all for that, because I encourage patients to try to figure it out for themselves, and I'm willing to, and we do free microscopes on patients who want to figure out if they're killing their parasites. They're welcome to stop by we ask them to call ahead so that we can have a spot, but we say, you call ahead, and we do free microscopes as part of the follow-up process on our patients, because our goal is to figure out what gets them done. And if we find something that's cheaper and works better, that means I can help more people. So I don't really care. I just want to know what works. I've most of the time when people are doing the Bragg's vinegar type of thing, they're doing a whole lot of other things also. So I'm not sure it's as much that as they made you.
I was thinking more on a regular basis, preventative care.
I'm not sure you can do parasites on a regular basis as a preventative, because parasites are very adaptable creatures, in my experience, is what I've found. So they find a way, and they turn into something else. But and I think our veterinarians have figured that out. They've done the in the feed all the time wormers for horses, and they've decided that was a bad idea, because you actually want to challenge your immune system with parasites every once in a while, because we should be able to fend them off. Okay, so if you constantly eliminate them, and now you've created a weakness in your immune system's ability to respond when they do have an attack. So,
But if you keep your body alkaline, which is the goal of taking something like
Right, right, right. Then you're going to create an environment where the parasites aren't going to be as happy to live. Right, right. And yeah, that goes along with a lot of other things because we test nitric oxide levels in patients' saliva too for the same reason, because if those are low, it don't matter. They're not getting better and things aren't healing if you don't have nitric oxide in your system. So we do all of that. Yeah. Bruxing, grinding, we talked about that a little bit already. But they cause all kind of problems. We'll do a short statement on root canals. Are a root canal an endodontically treated tooth? If it's any other organ of your body, is called gangrene, because it's an organ without a blood supply. That is the definition of gangrene. Okay, and root canals actually come in the same things as gangrene. Gangrene has dry gangrene, gas gangrene, wet gangrene, and we have root canals that do the same thing. Some of them just cause chronic calcification of the bone around the tooth. Some of them cause pus, and some of them, when you open them up, they have this nice sulfuric odor coming out of them. So a root canal tooth is nothing more than gangrene, and if somebody thinks gangrene is healthy in any of the other parts of the medical profession, we don't really see that happening much, but that's what it is. So even a perfectly treated tooth with a root canal that is 100% disinfected is still dead tooth without a blood supply, so that is called a culture for bacteria. So that's where bacteria get to come and grow. So when the bacteria are floating through your bloodstream before your white blood cells snatch them up, if they find this dead tooth, they now have a place to live. And the white blood cells can no longer get to them because they crawl into those little microscopic holes, which are too big for the blood cells to attack and get in there. And that's the same thing. And these are just some pictures of what root canals really look like. So thinking that your dentist is going to go down into all of those little things and clean and sterilize that. I have a laser, and even the laser doesn't go into every one of those little tubules that go out right and left. So they have, even the American Endodontic Society has said it's impossible. They have never found a way to 100% sterilize a tooth and get all of the canals clean. So that means if you leave any tissue in there, you've just left culture media for future reinfection at the best. Okay, and this is a cavitation. This is what they look like in the jawbone. It's just a place where you had an old extraction site, and the bone, instead of filling back into nice, healthy, cancellous bone, it just looks moth-eaten. And I've opened up some of these, and they'll have green slime in them. Some will have black slime. Some will have brown slime. Some of them will have nothing. It'll be just air. Yeah, I opened up one the other day, just on Monday that was. I mean, it was, I could stick my little finger up in the hole that was there. We opened it up, and there was just nothing left in there. It was just all gone. And, and this guy has been in pain for years, and they keep extracting more teeth on that side. And it's like, the pain never changes. Like, so let's stop extracting teeth and let's look at something else. And that's what that is. So we just have to look and clean those up. This is what I said about you can look at these on my website. You can go onto my website. There are lots of websites that tell you which teeth are connected electrically to each organ. And if you've got some issues with teeth, and the challenge, this can be a missing tooth. So you can have you can extract the tooth and have a cavitation in the site of where that is, and you can still have a problem with one of these organs because it's on that pathway, and you've disrupted that meridian throughout your body. Okay, and we talked about the sleep apnea thing, and we'd like to talk about the Healthy Start for Children, which is really a fantastic thing because we are going to prevent children from having to live there. But these are some of the things. If you have children aged 2 to 5 and they're in these categories, what they have been able to find is a significant amount of this behavioral problems go away when you give children air to sleep, basically, is what it comes down to. I think the references are on my handout there. And that's all I have. So I know I ran a minute over, but I'll still take questions. Yes.
Anybody have any questions?
Yes.
Your Altoona office.
Yes, my Altoona office.
Yeah, you have a number here for Huntingdon, but
I do not, because I realized as I was leaving the door that was old paper. So I would have a card, and I would be able, if anybody wants the number for the Altoona office.
Do you have cards up there? Do you have cards?
No, I don't have cards, but they made me put one in my pocket, and I think I have one. Yes.
Just tell us the phone. Yeah, just tell us the phone number.
I don't know the phone number. If I don't have a card, I don't know the phone number.
the Altoona office would be easier for people here, right?
There we go. It's here. The Altoona office phone number is 944-1300. All my numbers are push buttons on my phone. Sorry.
You are in East End? Would you say it's East End area, or what area of Altoona?
What area?
So that they know.
It is up by the district magistrate's office. We're down from the Salvation Army a little bit, so we're on like 4th Street. Yeah, it's 616 4th Street.
It's on St. You know where St. Mark's Church is, you get out and you turn there.
Yeah.
Magistrate's office is here, his office is.
Right on that corner, yeah. Yes. Yes, so,
Appliances for snoring?
pardon me?
You make appliances for snoring?
I do make appliances for snoring also.
How effective are they?
Depends on how bad the issue is. And if you've got corresponding muscle problems, spasms. So if we cure those, we get pretty good results in that case. Because, yeah, there's all kind of different appliances that range anywhere from $400 to $6,000, depending on how bad the situation is, really.
Have they got insurance?
Sometimes. So this is one of the goofy things. If you go get a sleep study and you get referred to me, then it will probably be covered by insurance. The challenge with that is now you're no longer ever insurable for health insurance or life insurance, because people with diagnosed sleep apnea are no longer insurable, because the insurance company knows you're not going to live very long if you have that problem. They have the numbers. Insurance companies never lose money, and that's why they choose to so if you've got that official diagnosis, you are no longer insurable, actually. Yeah. Some people maybe know that already, but yeah. Yeah.
I do have a question here. You have mouth breathing, dark circles under the eyes, and spelling?
Did I? I was having a challenge with my low grades in math and spelling. Okay, and that is because whenever you have oxygen deprivation in a child, they're still developing the logic center, the frontal lobe, that grows up until age 6. And if we watch, because we don't try to teach 4-year-olds math, we wait till their first, second, third grade, because that's when that frontal lobe finishes developing. And so if it's under oxygen deprivation, it may not develop until they're 7, 8, 9. So a lot of these kids that are diagnosed with learning disabilities at a young age were actually oxygen deprivation children, and given enough time, that can fix itself at a later age, but by that time you're already in the wrong place in the school system, and you sort of get stuck, and you're labeled as the kid that can't spell, and you can't do logical things, because spelling is a very logical type of thing, and math is a very logical thing. Yes, so some learning disabilities are really not learning disabilities. They are, and they call it sleep disordered breathing, is the diagnosis that they have in children now.
It's interesting. I have 2 of my 4 kids that cannot spell. To save their lives, they just
Right.
can't spell.
Yeah.
I thought that was interesting.
Do you do anything with anesthesia for children with CP, autism, Down syndrome?
I do not. Yeah, because my facility is not really equipped to handle what's going to happen, and 1 out of so many. Yeah, so you need to be in a full functioning medical facility to do that. Yeah.
What's your thoughts on this dry mouth syndrome stuff?
The artificial stuff that they have, or dry. Well,
The causes of that kind of thing.
Well, we know what causes it. Your hypothalamus is messed up, and it's no longer creating parotid stimulating hormone, and your saliva glands aren't working. So there are probably, I'm going to be kind and say hundreds of medications that cause dry mouth, and anything that's causing chronic inflammation in your body is also going to be causing you to have a high level of free radicals, which is also going to mess with your hypothalamus, which is also going to reduce saliva flow. So yes, reduce saliva. Yeah, milk is a great one. You know, you take kids off milk, their ear infections go away. You know, their mucin, instead of having mucin, they have real saliva. Okay, and that's just because of the lactose and some of the things in milk are doing the same thing. It's just creating that. So yes, so that is a systemic problem. You know, and medications are the biggest culprit. You know, and if you're not on medications and you've got dry mouth, then I'm sending you someplace fast because you have something that somebody doesn't know about yet. Yeah, because it doesn't happen in a healthy situation for you to be dry mouth. Now, once you're on meds, you're in trouble already from a different aspect. But yeah, and then you know what we try to do to prevent the decay is, you know, the synthetic salivas and different things that they've made. They've just come out with a new one, so we're hoping it's better than the last 10 generations that we've had out there. But the problem is it can, you know, we know why it doesn't work because the teeth are sucking fluid in instead of washing out, and the saliva glands are doing the same thing. They're not releasing saliva because your hypothalamus is telling them that's not the most important thing. I got something else going on here that I got to pay attention to, and we're not going to worry about the parotid hormone. Let's do something else. Yeah, and you know, probably you would check cortisol levels right away on somebody. Yeah, and so you need to go someplace where they understand cortisol adrenal imbalances because there's something going on someplace. Yeah, and I have to be careful when I start talking about other parts of the body because my license stops at C3. So if I fix something up here and something gets better down there, that just has to be an accident.
Okay, thank you, Dr. Hartman. One more
Yes?
question.
How do you stop a thumb sucker?
How do you stop a thumb sucker?
I have a grandson too.
Yeah. That is why we are starting to put the appliances in 2-year-olds because we've found that they will switch. And instead of having something that's going to cause a deviated swallowing pattern, you put the appliance in, and at 2 it's actually easier than 4 because at 4 there becomes an emotional addiction to that. So, and I'll let you know because I got about half of my 10 are ready to have Grandpa work on them and put these things in. And so I have a very active test case going on, and I have some of them that are very addicted to the thumb. But see, that does the same thing. They've malformed their mouth, and they need the thumb in there now to get oxygen even during the day because the thumb is acting as an obstructive apnea appliance. It's opening the airway, dropping the tongue, because otherwise, when it's not in there, their arches have formed improperly, so the tongue goes back instead of up into the palate. And so that's why then they need to continue sucking the thumb because they're not getting enough air. It's a structural thing. Yeah, and so that's why these appliances work. The guy was a genius. Well, actually, he wasn't a genius. He was OCD. He went and there was another dentist who took yearly records on every one of his patients for like 20 years. And made these little dental models, you know. Nobody would ever do this today because that would be crazy. And he let him come in and study and do all these measurements on it. And what he figured out was what happened here was very predictable here. And he did all the measurements and figured out, he says, well, with these kind of growth patterns, if we put this appliance in here, we should be able to change it to there. And he did it, and it worked. And yeah, and the orthodontic community as a whole doesn't like him at all.
Thank you very
Yes,
much.
I'm here. If you want to come and ask a question, that's fine.